لله الذي هدانا لهذا وما كنا لنهتدي لولا أن هدانا. We thank Allah to give us this opportunity that He has given us the guidance, for if it was not His guidance, then we will be in a loss. We are meeting here to discuss about how to handle the man of a home who has died of COVID-19. Alhamdulillah, we have the honor and the advantage of marjariyyat in our madhab, for which any problems at any time comes in, they are ready to give us answers from the hadith and from the Quran. So we are not like the other mustazabin who have no real guidance in real time directly from the ulama, the mustahidin. So whenever such a problem arises, they are the ones who give us guidance. Do this, do this, do this. This is allowed, this is allowed, this is allowed. This is no problem, this is no problem. And we follow their guidance. So what we will discuss here is in line with the agreement with Hazrat Ayatollah Sistani and also Hazrat Ayatollah Khamenei. The fatwa from Ayatollah Khamenei, I have not read it, but I have received directly from Sheikh Ali Dina. So what I will narrate here is what I have learned from them. Coronavirus is a respiratory virus. It does not spread by touch, not like Ebola. Because the virus of corona can only enter the mucous membrane from the eyes, nose and mouth. If we touch any place which is contaminated with corona, the only way we can get it is if we use our hands and rub our eyes or rub our nose or try to play with the mouth. Then the virus goes in. Or if somebody is near me and sneezes from the air, it goes into my lungs. Right. So the most important thing is to not have the virus alive anywhere. It should be clean. We should have our hands sanitized all the time, so that if I have touched anywhere by mistake, which is high risk for corona, for example the hospital doors, the doors when you enter inside the toilet, areas where there is more people going in and using the same place, then you sanitize your hands. And we know the method of sanitizing. These areas are the ones which are neglected areas. So you have to always make sure these areas get enough sanitizing. That's about corona. The virus will survive on the surfaces for about 24 hours. The smoother the surface, the more chance for it to survive. So for example, this hand railing is very smooth. If there is virus there, it will survive better than this table, which is also metal but it is rough. So the smoother the surface, the more chances of it to survive. Because it does not become dehydrated. So it is better to have a cloth mask, because if the virus goes there, the cloth absorbs the water, the virus becomes dehydrated and therefore protects it better than other masks. So it survives 24 hours outside. It can also survive to up to 72 hours in the toilet. So we know sometimes when we are washing marhum, they pass some pieces. And if it is within 72 hours, there are chances it may be there. And inside the lungs and in the body, it can also stay more than 24 to 48 hours. So, the ijma of the medical scientists is that if you have a marhum who has died of COVID-19, then all the precautions should be taken so that all the surfaces surrounding should not be contaminated. And all the other people who are participating also should not get infected. There is a reasonable risk of transmission from the dead person to a living person. If the body is fresh within 72 hours. If the body is in the mortuary for more than 72 hours, then the chances are very low. Okay? The masail of the tayammum and kafan. According to absolute wajib rukni of the kafan, the most important element of kafan, there are two. And the third one is ihtiyat wajib. So, Mulana, please correct me if I am wrong. The two is the kurti and the lungi. Just like ihram. The lungi and the kurti. Wajib rukni is a must. But again, if the situation allows. And ihtiyat wajib is the first one charge. So we usually, under normal circumstances, we have other sunnah things in the kafan. For example, the undercloth, with the tie undercloth like an underwear, with the extra cloth on the thighs, we put an extra cloth on the chest, we put amama, besides the lungi and the kafan. And then we put two chadar. Put one chadar and then the second chadar. So this is what we are doing in order to come to a nearest compromise with honor and dignity, at the same time with safety for the people around. So we are using this half size so that we saw a situation just like at home. In the home, the bed may be small or it may be big. So let us use the worst situation of a small bed. And so the marhum is lying there. May Allah give him long life. He's lying there and the relatives just call you that our marhum has died, and the doctor who takes care of him says this patient died of COVID-19. So immediately, we as a Mayat committee, we call each other and start preparing. And we start preparing. Now this is our preparations. I come from home with my home mask. This is my home mask. I come from home with my home mask. Now we are meeting as a team. So this is my team. Now we are arranging. So what do we need? We need PPE, personal protection equipment. I will remove this just because I want to be clear. Personal protective equipment, which consists of this dress, gloves, bigger gloves, boots, and mask. This is for my protection. The boots, the white cloth, the mask, gloves, and the shield. And a shield to protect my eyes. Now we have this equipment, but for the marhum we have to prepare, number one, the disinfectant. Number two, the sand for tayammum. Number three, kafur for hunut. Kafur for hunut. And number four, the kafan. Okay. And the plastic. So we will do the whole procedure here, and we will be talking loudly of what we are doing. So now we are meeting as a team to discuss what to do best for the marhum. So he knows the family, and he says the rooms which they are living is very small. We will have to go 4 people because the marhum size is such. Or 1 or 2 of us will be enough. So we will discuss, not for the eye of the marhum, but we are discussing how best to handle the marhum, so that not to expose anybody else with this condition. Okay. So now we wear our clothes and go with it to the house of the marhum. As soon as we are discussing here, we have already told the caretaker of Qabristan to make arrangements of digging the grave. So simultaneously, while we are going for this procedure, the Qabristan people are already arranging for the grave. And while we are arranging this, we are also trying to make some sunnah possible. In a difficult situation, it may not be possible. So we ask him to bring Jaridatain, the 2 sticks with date palms, if it is possible. It is dead of the night, and there is no other person to go and cut the leaves, or the leaves are not there, or there are many miles happening, then it may not be possible. It is sunnah. So now we have already done the preliminary work. And now we are arranging our soil. This is the sand. This is our camphor, which we will take in a small plastic, which is already crushed. This is hard. This is the sand. This is the whole set of the kafan. The plastic, heavy duty industrial plastic. And the tarpaulin for carrying. So now we are going there. So how to wear this? It is not worn like any other cloth. So first we have to wear the boots. someone who is helping you. So, there is one layer. So, there is another layer. This one is sleepover. If you wear full clothes, you can stay tight. Now we here, so we are a team of 3 or 4 people. So we meet them on our home today. Seek permission. Ask them to stay away and to watch or to do the salam. Quran is master. Then they will not be allowed. So they are far, they do salam, Quran is, and that's it. As soon as you reach one and they receive the phone, you tell them to kick the leg towards Qibla. Sunnah. It is possible. So you can move the bed, the legs towards Qibla, and make sure the eyes are closed. But with precaution, they cannot do it themselves because it is a risky area. Move the legs, cover the body. As soon as you reach the body, one of the team members is having this disinfectant inside. So we tell the relatives to go out. The Mahmoud's son or any mother's dad, the eldest son or the brother, or father, we don't know. So whoever is the water star can stay and participate with you. It is good because it is helpful to closure. So once we reach them, and we know from the doctor is certified, then we disinfect. And we take a piece of towel. Before I wipe or do anything, I put the mask on him. I take a piece of cloth. Wipe the face and wipe the hands. So in a piece of box or a piece of any small container, we put the sand on top here. You don't need to remove clothes. It's not ghusl. The marhum has died only a few hours ago. So his body is soft. You can lift it. It is not has become tight. Once you take permission from the Varastan that I am taking this responsibility on your behalf to do ghusl or to do tayammum, then you proceed. Then you have to make niyyah. Just like we make niyyah for ghusl. So I am making tayammum for ghusl mayyit in lieu of ghusl. And first ghusl is Abi Sidra. So the first tayammum will be in replacement of Abi Sidra ghusl. Then I have to do it. And I have to wear gloves properly. And to do the same procedure. Same. Right hand, left hand. Same again. And be careful. And then I get eyes. It's me who is doing it.
Hand is like that, no?
Yeah, it's complete. Make sure from the wrist until all the fingertips. Both the same. Right? And then left. 3 times. So we take the hands. These hands. And then we help and do the tayammum. Now we can't do tayammum because there is mask there. We will not do mask. So one of the helper does that. And we start from the hairline, where the hair starts. And you go all the way down until you reach the chin. Then, according to ulama, you can use the same hand without putting again on the same for the right side and the left side. It is sunnah to again have extra kumbi and then right from the wrist, make sure all the fingers are touched until the end. Abe Sidr is done. Same procedure now for Abe Kafur. Now for Abe Khalis. Now Ghusl is done. Ghusl, tayammum instead of ghusl. The next step is to do the huluk. But before the huluk, my team and myself, our team, our chairperson and other members, we start preparing. This is how we do to make it very easy. So now, listen, this is how now. So look at this. This is layer number 1. Chadar, outside chadar. This is the full time. You see? Full time. travel to Bali. Right? Clear? Now, one body here is going to push these layers below, and two of us are going to roll you. So, we are putting the stick here. But before that, we have to do Hunuk. Hunuk is done on the 7 parts which touch the chest. The forehead and the hands can be mixed with Kapha. But knees and toes should not be mixed with Kapha. So, this is Kafu. If you put on the forehead, put on the right hand, put on the left hand, put on the knees. If you have not taken out the cloth, then you can put a small tear. You put it there. Then the remaining, you can just put it over. So Hunuk is over. You do Nina, I'm doing Hunuk Purbatani now. If you have those sticks, then you put the sticks there. When you start now, you put the knee. Here, complete. So, in order for it not to move too much, we use a lot of cotton wool and put cotton wool here. And then we close this and tie it. So now the body is safe. Now we put chapter number 1. survey number 2. Then this body now it is ready to be buried. So we can now safely take him inside and turn him on the right shoulder without any risk because it's closed. So finally, when this is over, the way of removing the clothes is very important. So you remove the first layer and throw it in a bin where it will be collected for disposal. Then you remove with your gloves on, you remove the shell inside out. Now you are safe to run. And then make sure you thoroughly wash your hands or sanitize. It is simply a spray bottle to sanitize. This is thrown in the garbage. And you use your sanitizer. Somebody here will have a bottle of spirit to continuously sanitize. So after you do that, someone, then you can recite something. And you can recite the dua and mantra and everything. But recitation of talqeen is not an absolute wajibat. Talqeen is very important. But still it is not a wajib part. It is not an absolute wajib part. So somebody can miss talqeen, no problem. If the situation is that you cannot recite. In the body, it is sunnah to put sand on the cheek. But here we cannot open. We cannot open. So before you close, this sunnah part. When your hands are still in the glove, when you are here on wudu, you can take little sand and put on the right cheek. Usually the sunnah is, this is sunnah, so don't go into more sunnah things when it is such a risky situation. So when the marhum is put in the grave under normal situations, we open the knots and loosen the chadar to keep the face open to make sure it is facing the qibla. Then we take the sand and put on the right cheek and is on the right shoulder. And then we recite talqeen when the body is in the grave, open and things. So it takes a lot of time. So best when you are at home, maybe recite the talqeen and Surah Al-Mulk and other things. Finish them. But best to do minimum. So normally what we have done in number of our marhums, we recited talqeen at home and a small marcia and Surah Al-Mulk. And then we put the body directly to the grave without taking any time. So it comes whether from out or from here directly to the grave. usual, right shoulder, cover it, so that's the usual. We decided on behalf of the Mahmoud's father, and make sure you keep the social distancing of 2 meters. When there is a pandemic, there is a lot of panic. And sometimes some relatives don't even come near the grave to put you on sand. So you will be left only with 5 volunteers doing the job. And sometimes it's the opposite. There is so much emotional charge. They want to do everything, including kissing the Mahmoud and things like that. It becomes very hard because you are putting yourself at risk and the people around you. So we have to strike this balance and make sure that it is understood. So in the beginning we had a problem, but after 2 or 3 experiences and a lot of consultations, one most important thing we discovered, which is not written in any books, but it is humanity. Before you undertake the procedure, by wearing all these clothes, you go to Mahmoud's house, it's very frightening to the relatives, to the patient. Before you go there, one of the team members goes with normal clothes, talks to the family and says, this is the situation, and this is what we are going to do, and this is what we will expect. So that they understand what is happening. And when you are going to do the tayammum and this procedure, you also explain the senior people in the house that this is the procedure we are going to do. That one makes them very understanding of what is going on. Instead of just, go with that. All good, you are wearing like anything and you go like as if it is for our protection. It is not for scaring you. It is not for scaring the community. It is for our protection, and this is the best thing we have for protection. In a medical world, Allah is the best protector. This is what is the best thing. That's why we have to wear this. So before you undertake the procedure, explaining them is very important, and it really helps to make them have a closure. So if an elder family member, 1 or 2, at the social distance which is allowed, if they are watching what you are doing and you are explaining to them, then they fully understand. The regulations and the advice of our Sistani in the World Federation document and the Ijma of the Ulama Europe, they have written this, depending on the situation. So sometimes, if a marhum dies in the hospital will give you the body in completely sealed plastic, and you are not allowed to open it. Opening it is even more riskier because there is a lot of air and steam inside. If you open, you will actually find some hissing sound of air coming in, and that will be even more riskier. That's why you are not allowed to open. Aga says, you can do the tayammum on the plastic plate, You can put the coffin on the plastic plate. It is allowed. If it is not possible, they already have put in a sealed coffin, then it is allowed to do on the coffin.
How to do the demo on the coffin?
Just symbolic. Just symbolic. You know this is the head part and this is where the hands are, just symbolic. You do the same masa on the soil and you do it on the upper head of the coffin with the niyyah. Keeping in mind, this is probably the face of the marhum. These are the hands to right hand. Only symbolic. In the worst case scenario, when the government hospitals in some countries, they already seal in plastic, they put in the coffin, they nail the coffin and they only give you this, and they bring the inspectors to make sure you are not opening it. then you can't do anything. Then this is a very worst situation. Allah allows in those situations that even the coffin, because it is wrapped in plastic and put in coffin, even the coffin, just put it on the coffin, up, just above it, just keep it as a symbol. Because you are much good, you can't do it. It's an extreme situation. In fact, in extreme situation, if the dead body is of such a condition which must be cremated, then cremation is allowed. Extreme condition. We haven't reached them. But Ebola mayat cannot be buried. Ebola mayat has to be cremated. Because even the slightest touch with your own little sweat is enough to transmit Ebola to you. And it can cause death in 24 hours. So Ebola is very dangerous. So people have that fear of Ebola in the background. People have all that panic. And now this happened. So that is the situation. But for Corona, I think doing this procedure and following the inshallah there will be no problem. And both the honor and dignity as well as the safety and health of the living people will be taken. It's a good compromise. So what if some family says, no way, I have to give ghusl to my father? Then the duty and responsibility of giving ghusl kafan is of the family, not of kafan dafan committee. If you want to do it on your father, do it. You are taking the risk, do it. Take a chance. If you are going to get the virus and spread it to your family, you will be responsible for it. If you do that, make sure you isolate yourself for 14 days in case you develop any signs and symptoms. Otherwise, you will spread it to your family. So people ask that question. So suppose that if I would have done on my father, then what would happen? Then you might get it. So what would be best? Isolate yourself. If you don't get it in 14 days, things are okay. But you have to isolate yourself. Real isolation. Not isolation from family, but you are in the shop doing business, spreading to others. That's not isolation. So it is very hard situation. As a medical profession, we tell them, don't take the risk. Because there is risk involved. So you will find many blogs and this, WhatsApp, Fasad thing in the world. Some says, this Jamaat does this way, this Jamaat does this way, this Jamaat does this way, we do this way. Every Jamaat will do according to what the situation dictates in their country, in their town, in their situation, in their ability. So you focus what you have to do. If you have 5 rooms, with negative airway flow, and a professional disinfectant, which costs about 3,000 pounds for disinfecting 5 rooms. And you have to not use that room for the next 48 hours. First room, you wear the clothes. Second room, the body is brought there and you do ghusl. Third room, you remove the clothes. From the middle room, it goes to the 4th room, where people are already wearing the gowns and only doing the kafan. and there is such air condition that only air goes in one direction. Once you finish the procedure, all your these clothes things are burnt and the whole facility is disinfected. And it is far away from the community, not like here, people are going to pray namaz. It's not possible. Then you can do it. You have that facility. And because some countries they keep the body in the mortuary before they give you the certificate after 3 days. So in the mortuary it's already minus 90 degrees. There is no virus you are going to survive. Even virus father will not survive.